Dear colleagues, thank you very much for being invited to this very interesting panel. And dear Leah, thank you very much for this really open and frank description of your situation. And hopefully you will achieve what you talked about. And I really liked your sentence, as you said, that testing without any action is not a big worth for the society. And this is the case also here in Germany. Testing with action afterwards, what is the result of the test is very important. So my name is Michael Müller. I'm a lab physician for now about 30 years, and I'm a chairman of a professional organization which is named ALM, the Accredited Laboratories in Medicine. We cover around 200 labs in Germany, 25,000 staff, and around 900 specialists in medical microbiology and laboratory medicine. And my presentation was titled Testing, 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 but Targeted, in reference to a very basic position paper of the German Ministry of Health from April, which is underlined in this, which was titled in the same way, and which is, for me, summarizing the big issue that it is important to test widely, low threshold, but you have also take in mind that the test strategy should be targeted. So testing without any cause, with any reason. A lot of asymptomatic people tested could mislead the interpretation afterwards. So thank you very much that I got the opportunity to present. And first of all, I would like to give a short overview about the infection itself, because the infection itself and the agent, the virus, and the possibility to detect the virus directly or indirectly is one of the founding things for a test strategy which you might conclude out of knowing about of the infection. And we all learned in the last 6-7 months, starting in January, when nobody really knew how to detect SARS-CoV-2, that this infection is still a continuous learning process for us all. And so it's very important to adopt the knowledge, to adopt strategies, to adopt testing capacities to the knowledge we gain within the time of the period. So the infection may come into a person, there might be symptoms or not, they may take a certain period of time to be seen from the person itself or the physician, where the person might go to get counsel, and the physician might see the symptoms as COVID-19 related or not. So there is a lot of different cell diagnostic process in the beginning, and we have the virus which is replicating in the body and will enhance a detection limit on some kinds. And so there is the possibility to detect the virus. And we have always 3 options, which is the direct NAT test, the PCR test. Around last Sunday, we did in Germany around 70 million of those tests. So this number 13.5 million is 2 weeks ago. Now we face the possibility to use antigen tests, which may be a little bit less sensitive, which may be different in specificity. But if we get to know more about those capacities of this antigen test, they will play, I'm pretty sure, a certain role in the test strategy coming up. And Tim Ekman's also already mentioned it before. And we have seen the antibody test, and they were very promising in the beginning. We thought we could see something about immunity and immune status, and we have to face the fact that this is not really possible at this time. There might be a combination of cellular and humoral immunity, and we have to see which test can do something about this. So the tests of antibody is not that popular in Germany at this time. The numbers from the GPs and the specialties being referred to the labs are slightly getting down around to 10,000, 20,000 a week right now. So coming from this, a society will lead to the test strategy, and Germany had concludes the national testing strategy in a discussion process starting in March, and this strategy is published on the homepage of the Robert Koch Institute This was done in, I guess, end of June. And the national test strategy is the guidance for the physicians, for the GPs and the specialists who should be tested, the time of testing and the test method which should be used. And also we see that this infectious disease, COVID-19, is pretty much an interdisciplinary challenge for all specialists, for all physicians involved, whether they work in the outpatient area or they work in the hospitals. Who should be tested? We focus in Germany on 3 issues. We want to detect all infected people as early as possible. We want to get the contact list of those people being infected and try to test them as early as possible to interrupt those transmission chains as early as possible, that the infection cannot spread around into the population, and we don't know where this spreading around takes place. This would be very critical for the public health system, and Andreas Bobrowski mentioned it before, that the public health system to identify the contact people and to reduce the contact list and to get the contact person tested is very critical in estimating the right infectious numbers in the society and get the people to decide what kind of actions to reduce the spreading of the infection could be successful or not. And we also would like to protect the vulnerable people, which are more or less the elder ones, the ones who are in hospitals, who in elder care units, and we try to get this covered by special testing concepts, or also for schools and childhood facilities, that we try to get those people better protected than in the beginning. And also, if there is capacity for testing, we try to do an occasional low threshold and expanded access to tests, that everybody who would be in concern of being infected, everybody who would be in concern of having a contact, or everybody who would have unspecific symptoms, which may be in accordance to a COVID-19 infection, is able to access directly a GP, a specialist, a testing center. There is a very famous number 116, 117, which can be called to get a counsel and the access to a test and to a test center. And I learned that a lot of really, really good and reference papers are done by the World Health Organization. The last one was done end of September due to the tests themselves. And also the World Health Organization published some criteria to evaluate and adjust strategy itself, and it named that the positive test rate should be under 5% in the frequency if you look at the weekly testing, and we will see afterwards how we are there in Germany. And it's also interesting and critical that more than 80% of all cases of the positive test of the confirmed people, they could come from contact lists, so from known contact and transmission chains. And if you are have a higher positive rate or a just lower rate of cases which come not from contact lists, you are under risk that the spreading of the infection is not under control anymore. So the test strategy should focus on this, that we can always try to control better the spreading of the infection. And I really like this slide, and I tried to bring you through this, looks like wool, colored wool, but I will try to bring you through it. We have a summary of the weekly tests and the capacity and the positive results, which is published by the Robert Koch Institute every Wednesday. So this slide is very actual because it put in the results from yesterday evening. And the Robert Koch Institute is always also supported by a voluntary inquiry which is done by the ALM, pretty much supported by others like Andreas Bobrowski's group, and also Ralf Ignatius' group of the microbiologists and the other laboratory specialists in Germany. And we see 3 colors. We try to start at the yellow one, which is the summary of the weekly confirmed infected people, which is now around 300,000, 289,000 last Sunday. We see this yellow one is the weekly number. You see the column here, at this side in March, it was around 37,000 a week. Then we had the summer period with lower than 2,000 a week, sometimes here this time. And then we see an enhancing of the positive numbers per week. And I come to describe this gray columns here also. In green, you see the number of tests done weekly, which was in the first weeks. And we have also numbers from the first week up to the 11th week. Ms. Seifried from the Robert Koch Institute and I, we try to collect this and then try to publish them in a paper within the next week, that we see when the real testing was started in January. And we came here to 100,000 to 200,000 tests per week, which was fairly on the same level, around 300 to 400,000 tests up to the summer in June. And then there is a continuous enhancing of the test number per week, which is easily to be described what the reasons are for it. And we have the blue one. The blue line is the test capacity per week from the labs reporting. And you see that capacity of tests was really pretty much doubled and multiplied within the first months, from around 100,000 a week up to now 1.5 million per week, which is 15-fold within a time of a period of 6 months, which is a real good job what the labs did, what the Society of Scientists did to develop methods, and what also the IVD industry did to provide those tests on a quality and safety level we requested to get best results possible. You see a continuous line and you see a intermittent line. The continuous line is the result of the data collection of the ALM and the supporting labs, and the interrupted line is the line from the Robert Koch Institute, and you see they are pretty much going along, and you can see only some differences which are not very much important to see the general view. Now the gray ones, in March there was a really big concern in Germany about the infection and the spreading of the infection. We had critically rising test numbers and numbers of infected people per week. And this was leading the politicians to come with the first start of the contact restrictions in March. Within a time of a period of a couple of weeks, the number of positive really clearly was reduced up to a fairly low level of about some thousands per week. In the same time, the labs really enhanced their test capacity to be able at any situation to cover an outbreak, to be able to detect infected people, to test the contact list as early as possible. And you see in the beginning, there was a test capacity lower than the test volume. There was an enhancement, and a long time the test result would be handed out to the infected people. Not very nice and not very good for covering a pandemic. But now the test capacity is always higher than the tests done per week, and which is critical to be able at every time to have a good estimation about the spreading of the infections. In June, at this time, the Ministry of Health published the first testing directive, bringing out rules who should be tested or who not should be tested. And then we had a critical outbreak in the meat industry in an area in the middle of Germany. The town was called Gütersloh, with more than 15 or 1,800 infected people detected within just a week. And that it was necessary here, you see it on the test number per week, that within 1 week, 50,000 tests more had to be done to cover the knowledge about this really critical outbreak in this meat industry company, just one company. And the responsibles here did also a very widely testing into the people living in this area to estimate and to find out if the infection was spreading out of the meat industry into the population itself or not. And this was one of the cases that the labs could show how easy, how fast they could adopt the test capacity to get the responsibles known how this infection would develop in certain countries. Then you see this column, end of June, the Minister of the State of Bavarian published a test strategy and allowed everybody to go to a test center to get a test for free, even he or she had symptoms or not, or just wanted to know if she's infected or not. So a lot of number of tests without any cause. We really discussed this really open, and there were not many people out there who supported this test strategy, but it led to the case that more test capacities were taken from this test strategy. End of July, the first directive of the Ministry of Health was adopted, and then again, first week and second week of August, and this was pointing out all the people coming from their holidays from foreign countries where the incidence of COVID-19 was a bit higher, and those areas were named as risk areas. And so this directive pointed out that everybody coming back from a risk area had the task to get tested. And this also led to a really dramatic enhancement of the tests we had to do. And the test capacity was really drawn almost to 100% in some regions, and labs more than 100%. And now this test strategy of the German Ministry of Health is adopted again mid of September. So this period of holiday and holiday testing is changed into a test strategy with, starting from today, that the test after a holiday coming back from a risk area can be done 5 days after being in isolation. So then we have more correct tests because they are done on the really better time of the incubation period of the infection. So this is the overview of the testing in Germany, and you see that the testing capacity and enhancing the testing capacity was at all times critical to be able to do the number of tests being asked for the labs. How is this done? The availability of the test is also critical when the labs are really out there everywhere in the country. And I think Andreas Bobrowski mentioned it before. We have more than 90% of the tests, they are done in outpatient medical specialist laboratories. And those labs, smaller labs, bigger labs, labs formed in groups, they are able from the northern part of Germany to the south part, from the east and to the west, to get more or less direct access to the samples, because we have a really good logistics system. The labs are going to the facilities, to the GP office, to the test centers, and they take the samples to the lab. And we have put out a landing page where everybody can see is the lab in the surrounding or not. This is the focusing of the Berlin area, and you see already in the Berlin area there is more or less than 10 labs around here covering the COVID-19 diagnostics for them. So we see also that the specialists in the lab, and besides the specialists for lab medicine, they're in fact more the microbiologists who are responsible for the COVID-19 PCR and antigen and serological testing. They take the overall responsibility for the whole process, because to our opinion, COVID-19 diagnostic is a physician's responsibility and a physician's job, and the physician should be responsible, consult for indication of the test, should be consulted for interpretation of the test. We can discuss later what about CT of 35 and sickness, what about CT of 35 and no symptoms. And Andreas Bobrowski mentioned it also before, the test labs worked almost 24/7. We started Monday to Friday very, very early. We enhanced our capacities to Saturdays and Sundays. And this is also a good time to say thank you to the staff in our labs. They still work almost round around the clock. to get the lab tests done and to be able to report the lab tests result to the senders, to the test centers in less than 24 hours after the sample was taken to the lab. Digitalization is also an important point. I mean, Germany is not #1 in digitalization in an international comparison, but we do our job and try to get better every day. And so we have electronic order entry systems. The Ministry of Health very successfully promoted and installed the Corona Tracing app. And we are almost ready to report into the public health system if anybody is positive tested, so that the public health system is easily able to get the information and to act with this information to identify the contact lists. It's also common that in Germany the labs are doing the swab supply to the test centers and to the GPs. It's also in Germany the case that the logistics and transport system are more or less done from the labs themselves. And what's also different to other countries, the private labs are the ones in Germany who are running most of the test capacities, and it's a private investment in the enlargement of the test capacity. So it's critical, and it was also mentioned before that in Germany the healthcare system decided end of January to reimburse the COVID-19 PCR testing, so that there was no doubt that the reimbursement was safe, up to some discussions in the middle of summer, but this is more an internal thing, and we can discuss it later maybe. So testing people is not only measuring a value or performing a test from somebody who might have learned this. It's always a consideration of guidance for the best and effective tests which you can get. This might be PCR. This will be also antigen testing within the next weeks or months. This can be also antibody testing. And in Germany, there is a good connection. There's also the opportunity to say thank you in representative here, Tim Eckmans, to all the scientific community. There is a very, very good interaction between the scientific community and the ones in the labs who do the tests. So we follow the recommendations of the Robert Koch Institute, we follow the recommendations and the custom of the World Health Organization, and also of the professional society, where most of us are also members in, so we can discuss. What we learned is critical, that we should not be dependent on one method, and it's better to have different test protocols in the lab. We were also very, very happy, due to quality management, that the Instant organization in Germany was, I guess, one of the first internationally to provide an external quality assurance, a ring trial, that we as the labs internationally were able to get a guess about the clear and the really quality performance of our tests we implemented in the labs and we bought from the IVD industry. And it's also critical for us that the test result itself will lead to a direct interaction from the healthcare system to the people tested, that this test is medically validated through a medical experienced specialist who get to know, maybe by phoning to the GP or specialist who has sent the test, if a positive PCR test could be correct or not correct. We have faced cases that it was really, really important, the direct communication, and I guess Ralf Ignatius will point out some examples later on. So we have also in this area the task sometimes to rerun a sample from the same person to see if the reaction we have seen in the first PCR is truly positive or not. And this is always done within the same day, so that we don't have a reporting time to the sender over 24 hours after starting the test. And we have to point out that our medical report in the labs is the basic for a clear conclusion for everybody else dealing with this and working with this medical report. The Data communication system is also very critical. I already said that Germany is not one of the best internationally, but I guess, and I think the Corona warning app as a tracing and track app is really one of the success factors. We were really under pressure due to data security and data safety. Germany is here top one, I would say. So the organization of the transmission process of the sample, there's always a unique QR code come with it to the lab. After entering to the LIMS, to the information system, and after having done the test, this QR code and the test result is transmitted to a server construct which is provided by the Telecom and which is handled by the Robert Koch Institute. And this can only be done when the person who is tested admits to this transmission way. And the person, when it then scans the own QR code, will get the result transmitted to the own Corona Warn-App. And there again, this person is the only one to decide whether the test, might it be negative or positive, is being shown in the app or not. And then there is an anonymous interaction between the smartphones so that somebody else can be warned if there is something positive. We see an upcoming and a rising number of people admitting to this process. And we see now a two-digital percentage of test results from the lab being transmitted to the system. So in the next week or months, this tracing app will, I guess, really develop the function and the success it was installed for into the community. And we also are now more or less, this is a card from Germany, all the green parts, these should be the parts where the labs could easily and directly transmit the results also to the public health system. There the results are collected and transferred to the states and from there to the national level, to the Robert Koch Institute. And this should lead at the end that the Robert Koch Institute and the National Health Ministry can directly see on a daily basis how the infectious disease, how COVID-19 is developing and how are the numbers. At this time, there is a more or less manual report with Excel tables on a weekly case, and we want to improve it to a daily action. So I come to the end. I think it's clearly that the national test strategy, testing, but targeted, should be followed consequently and directly. And this should also be adjusted nationwide when new things will come up. And Tim Ekmans already mentioned that the antigen tests will be implemented in the test strategies. The discussion is done at these days, and we expect the National Ministry of Health coming out with a new national test strategy next days, because they announced that the directive will be changed from mid of October on. It's also critical, we think, that there should be a good balance between the interest of medical specialists, of public health, also of science, and also of the society itself, the politics and the economy. And Leah pointed it out further in the last talk, that the society has to accept what we propose, that everybody has to accept that following social distance, hygiene behavior and masks as the most important permanent prevention for the infection itself. Testing is just looking if this was successful or not. Self-testing is no therapy, is just one of the tools getting more access to information, to estimate the spreading of the infection and to follow with the good decisions about the action according to this. So we also face a global PCR test demand, which is going higher and higher and higher, and this will limit the national capacities which a nation like Germany could achieve by buying those tests. So we have to deal with the limited test capacities in every nation, and this will lead to the situation that we have to follow a good test strategy and may supplement also the strategy with efficient other tests like the antigen tests I also mentioned, this is then critical that we discuss how big the difference can be between the sensitivity of antigen and PCR tests that we would expect to follow a good pandemic management. So thank you very much for listening to me. I'm very thankful to be part of this panel, and I'm happy to see you in the discussion. Thank you very much.